Good morning, everybody. Thank you for the kind invitation. I'm working in the bordering region in Veneto and in the city of Verona, but to introduce myself to you, I have to say that when I was appointed as Director of International Affairs at the for the regional government in Veneto, I was able to organize the European Medical Travel Conference in 2010 in nearby Venice, in a private hospital, which include in the compound the hotel, which is one key message, one first message to all of you. The second, in 2015, I was part of the working group set up by the Commission to evaluate the implementation of the EU directive on cross-border care. And I'm also representing the Sun Academia, which is a training healthcare center based in Carinthia, Austria, where we aim to develop a common curricula for health workers, doctors and nurses. And I'd like to point out that quality of care for medical staff is not the same across the border. The same risk management is not the same across the border. And also staff, dentists are included in the medical staff in some countries, are independent in other countries. My job today is to offer you an highlight about the implementation of the EU cross-border directive, with some concrete examples. But I'd like to start with the background of the directive. As you may see, we have a new patient in Europe with a lot of facilities in traveling. And since 2004, we have a common healthcare, a common European health insurance card. Thanks to this, a lot of citizens, they said we are in the single market. We can have the right to move across the European Union, and we have the right to use all the services across the Union. Unfortunately, it was not the same situation for hospital services. And we start by saying that in 1998, a patient from Luxembourg went to be treated in France, and then she went back to Luxembourg asking to be reimbursed. And the Luxembourg said, no, I cannot reimburse you because you were not pre-authorized. And this person used, thanks to Mr. Kohl and Mr. Decker, they applied to the European Court of Justice, and they won. So the European Union was forcing the Ministry of Health in Luxembourg to reimburse the medical cost for this person. In 2004, a lady, an old lady from UK, she decided that due to the long waiting list, she was in pain for hip replacement. She went to France without authorization. Again, she went back, she asked to be refunded, and the UK ministry, NHS, they denied. So she went to the European Court of Justice, and she won the case. So she was reimbursed. Just to say that more and more people are traveling across Europe, and in the future, more and more pensioners they will be traveling. It's estimated that 800,000 pensioners are traveling during the winter season from north of Europe to south of Europe, carrying, obviously, chronic conditions and using the healthcare system in another member state. It's very good because for the local economy, it's very good. But the hospitals over there, they are not really very well prepared. I'll give you an example coming from two regions from Italy that last in 2007. Veneto and Friuli Venezia Giulia, they have heavy numbers for tourists, foreign tourists, more than 6 to 10 million every summer. Foreign tourists are traveling to Veneto and Friuli. That's why we decide jointly to sign agreements with two German health insurance companies. Just to give you an idea, TK is a big company with more than 7 million insurees and with the annual budget of 17 billion euro, which more or less is the same budget for Lombardy region. And they said that we want to sign an agreement if you have a number of hospitals that can sign the agreement. So more than 50 hospitals, 50, they were part of the agreement. The hospitals were promoted by the website in Germany by saying to the insurees, if you travel as a tourist to Veneto and Friuli and you have any health problem, we have an agreement, and you ask the permission and you will be treated not only for emergency, but also for planned care. It was 10 years ago. And this is the official agreement, Friuli, a region, official agreement that was signed 10 years ago. The same was done also for outside the European Union for a Russian health insurance company and an American health insurance company devoted to expatriate Americans. And we go exactly to the main business in Veneto and Friuli, which is the tourism. Obviously, for foreign tourists, more than 6 million per year, we serve emergency, but also we have decided to improve the quality of health services for tourists. Here we are in the north of Venice, and in addition to emergency services, and we have also primary care services for tourists, foreign tourists, and we have also 12 beds for hemodialysis. How is the system? In January, February, people they are sending the official documents and data, and they book for hemodialysis in the same time that they spend their vacations. Another important agreement, which is in use before the EU directive and it's working, is the agreement between Malta and Tuscany. Bone marrow, liver and lung transplant, neurosurgery, radiosurgery, and rare disease. The agreement is officially approved by the government in Tuscany and is with the support of the national carrier airline Air Malta, which offer tickets at a low price. This was done, and it's before the European Union has decided to set up the directive. A long discussion, a long debate. Finally, 2011 was approved an official European law to offer to the patients to move across the member states and to exercise the right to be treated and to be reimbursed, and to have also the assurance about safety and quality of the cross-border healthcare services they will receive. In addition, obviously, to the directive wants to foster the cooperation between healthcare systems across the European Union. It's interesting because it's for hospital care, but also for non-hospital care, including the Italian patient traveling to Croatia for dental care. And it's interesting that the directive points out especially the information available to patients. Okay. In each member state, we have a national contact point that have to facilitate the current information on the opportunity for treatment abroad. Unfortunately, only 6 countries that were able to implement the directive. That's why only 100 Italians in 2015, they were able to be treated abroad, outside Italy, using the directive. But there is Article 12 in the perspective that is quite interesting for all of us. It's the creation of the European Reference Network. There are network of specialized hospitals that they will tackle rare disease, chronic conditions, specialized care, cancer, tertiary care, transplants. Just for rare disease, 24 networks for single rare disease, they were already approved. If you are inside one of these networks, you are in a special club, and you decide you are in the center of the debate, including the debate on DRGs. I'd like to conclude by saying that to be part of this network, we have also the certification from the National Ministry of Health, from the European Commission. You have a better standardized procedures that you can debate with your colleague, and you have also the possibility to have dedicated budget and money from the European Commission. And in my opinion, using the directive is the best way to attract patients to Italy. I'd like to conclude that it is impossible to conclude about the directive in 10 minutes, so I'm available at the end of the sessions if you need to ask me any question. Thank you very much.